Actually, it is dependence would take mark, okay? But you have to write the option. You have to write the answer. Yeah, okay. You can write the answer at this box.
Answer.
No, sorry. Answer in this option A or B. Yeah, you can write the option A, B, C. Actually, yeah, in the instruction it is mentioned put tick mark. Okay, but we couldn't make it, so that you write which option is that.
Suppose this option is A, just kindly write A into this box.
You all know that group, no? Ma'am, we gave no. Okay, no problem. Then one group is now organized.
Take one more.
No, right, not for this, we can use network also. Move fast.
You didn't have MCQs account in your examination system, no? Defining, analyzing, sift and sort. And later identify learning objectives, go and learn and come back and talk. Okay, that's the thing. Clarity means you need to understand that what exactly your topic is to be discussed. Okay, and second is defining it. Okay, what you are just like it's a wider one, no? You need to focus what exactly is. This scenario when I give it is a broader one, and you have to narrow yourself that what is the content you exactly wanted to learn it. Okay, that is a defining one. Then you analyze it. To analyze, they are given this kind of questionnaires. Okay, these are synthesis level of knowledge, where they given the questions here to analyze your skills. Okay, and later on sift and sort. Then whatever you learn, see they are given the learning outcome also. This scenario, if you work in the clinical, if you come across a case like this, how will you handle the case? Okay, how will you find out HIV? How will you diagnose the HIV and everything? Okay, you how to apply it. And finally, identify your learning objectives and go and learn again. Go and learn means like go to the clinical setup and learn it and come back and talk. That is it. Tomorrow you have.
How is patient confidential here? Then conditions associated with HIV, methods of transmission, infection control measures, testing, when and how, diagnosis of HIV, concept of blame related to health stat. Any question you cannot understand in detail. Read, just go through which questions you can't understand. All questions you understand.
That's very important. To leave the group, make everybody involved in the work. Okay.
The confidentiality. That's what you see.
And sometimes even you can
Confidentiality. Confidentiality. Equality and diversity. Equality and diversity.
Okay.
You will find out how is HIV diagnosed. One question number one. Okay. 16, 17. They will get in book. Yeah, that all will be given. 1, 4, these all people will find out that one. 1, 4, 9, 10, 11, 12, 16, 17.
Transfer HIV positive. Okay. Then preparing for third protein.
We have to within 1 day we can identify. Now important part is this was we understood about HIV, right? Yeah. You all know what is HIV. You know what is CMV, cytomegalovirus. What are the symptoms? Yeah. You know na? Just now read out. Yeah. You know what is HIV? It is almost similar to HIV.
Hand washing. Okay. The first universal precaution is always hand washing. Okay.
Okay.
Next is how is HIV spread? HIV is spread through, we all know, right? Sexual transmission. And next is perinatal and blood. Okay. In perinatal, menstruation, pregnancy. And all the liquid body fluid now, it contains HIV virus, so it will be transmitted from them only. So mother to child, it will come in perinatal transmission, that during pregnancy, during breastfeeding.
And then in the late will be less than 200.
Good evening, student. July 30th, we had a first session on problem-based learning on HIV, and today we are going to hold a recapping of first session, which tells you that how much you have learned about the first session and your kind feedback on that.
Hello everyone. Previously we had gone through the problem-based learning. So today's section will just have a recap of that section, and we will just go with the in-depth knowledge regarding HIV. In this, I'll just come up with the introduction of the HIV. So HIV is very common topic. It's a human immune deficiency virus, lentivirus, and in which there is progressive failure of the immune system. Can you just discuss about the incidence of HIV?
Thank you. Thank you for recapping the previous scenario. So if we go with the incident rate varies from country to country. If we talk about the India, if we take our India incident rate, among the female it is declining year by year, but whereas in male it is increasing, that is 4 more than the female rate. The age group among the age group 24 to 35, this age group is very high incident rate, but whereas in age group 13 to 24, it is varying the low incident rate. So recent studies have shown that male is at risk for the incident rate. So the male is varying the high incident rate. Can you continue with the etiology?
As Diva has discussed, we know that HIV virus is a positive organism of this HIV. There is a misconception among the people that by sitting with the person, by hugging the person, by kissing the person, we will get HIV. But there is nothing like that. We have to understand that by sexual contact, by the contact with the secretions like vaginal secretions, semen, saliva, etc. Then like breast milk, like that only the person will get HIV into their body. So especially there are four ways it will enter the body. That is by sexual contact. Mainly it is sexual contact, especially with the sexual contact with the person who is affected with the HIV and with the sex workers if we are having without condoms. We are getting preventive measures. We should have preventive measures. Then by this blood transfusions. Then from in pregnant mother who is affected with HIV, from the mother can be transmitted to baby. That's all.
So after etiology, like risk factors, maybe there are so many risk factors, no?
Yeah.
Thank you. Let's talking about risk factors. The main problem is multiple sex. One who is having sex with multiple partners, like that, that's the main risk factor. That's unprotected sex. Without using condom, they are going for sex. Then we are behind the fashions, like tattoos, piercing, that unsterilized equipments, no, that will also cause this HIV. Then we are talking about everyone will go for cutting hairs and all. So that equipments also will cause for HIV.
We need to change blade. We have to change blade. That is very dangerous.
That may also it can be out.
As we know everything about HIV, that is well. So let's talk about the pathology.
So people want to learn regarding how it affects our body.
So to know more about the pathophysiology of HIV, HIV has got a complex pathophysiology, but we can make it simple in order to understand, as we have discussed previously in our previous session. Then this pathophysiology of HIV goes like this. When the HIV virus gets into human body, it attacks mainly the lymphocyte cells. When it attacks the lymphocyte cells, it will go for CD4 from there. CD4 cells has got the surface receptor for this HIV virus to be attached. So once the HIV gets attached to CD4 cells, there will be there will be replication of RNA virus to DNA virus. That DNA virus will be the provirus DNA. That means it is the DNA of the host. Host means the person who gets infected with HIV. Then at that time, there will be, once the replication of RNA into DNA has done, there will be the production of more virus of HIV infection. When there is more virus of HIV infection, from that time, there will be decline of CD4 cells. That means the immunity of the person will be low. Once the immunity is low, the person will be more prone to more infection. That means opportunist infection. From that time, the signs and symptoms will occur.
Okay, we have seen etiology, we have seen incidence, we have seen risk factor and pathology, how HIV virus affects our body. So now let me deal about signs and symptoms of HIV. There are mainly two stages. First one is early stage of HIV, and then second one is chronic stage, or it's also called as latency phase. So in early stage, in a period of 2 to 4 weeks or even up to 3 months, the patient will manifest symptoms like fever, chills, rashes, and night sweat, and nausea, vomiting, and swelling of lymph nodes. Yeah, these are like common manifestations in the early stage of HIV. Now, in second stage, chronic stage, when HIV proceeds to AIDS, then person may have no.
Okay, so signs and symptoms we came to know. So to make it sure, like how will you know one is having HIV?
So I tell regarding diagnosis. Thank you. Diagnosis. When the person shows signs and symptoms, obviously he have to undergo test. So we need to go for blood test. Mainly HIV virus. HIV is diagnosed through a blood test. And blood test, as they have already told regarding it will affect CD4 cells, CD4 T cells. So we need to undergo CD4 count. So when blood test is done, when CD4 count is less than 200, it indicates that person is affected with HIV virus. And main thing is viral load. When blood test is done, they will show viral load. But if more virus, like if virus is present in blood, more virus is present in blood, it indicates that person is affected with HIV virus. So let's see regarding how this HIV is managed or treated, prevented.
Okay. That below 200 means it will indicate it is HIV.
So like normal person, it is 500 to 1000 cells per cubic millimeter.
Yeah, thank you. And let me go through something related to prevention of HIV. Prevention, it refers to practices done to prevent the spread of HIV or AIDS. The HIV prevention practices by an individual to protect his health or in his community those who are affected or infected this infection. So it can be by through any private or governmental organization or any other private organization as per the public health policy. So let me go through now some pharmaceutical strategies which we can tackle, and it may be like different kinds, like microbicides for sexually transmitted diseases, and pre-exposure prophylactics and like post-exposure prophylaxis. Along with that, we can go for circumcision and HIV vaccines. When we go through HIV vaccines, it's a very primitive stage of development. Like it acts on monoclonal antibodies to the virus, and along with that, we can go for anti-retroviral drugs, as you know, like antivirus and protease inhibitors, and yeah, of course, condoms also. The ultimate prevention of this is once you know about this HIV/AIDS, then there is no infection, then there is no HIV. So along with that, we can go for some social strategies like sex education and LGBT. Like LGBT means lesbian, gay, bisexual or transgender sexual educations, and of course like sexual abstinence. Along with that, like immigration regulation. As we all know nowadays, through immigration, the lot of like spreading of HIV from the countries to another countries, like from, as we all know, from some low developed countries to high developed countries. Because of that only our developed countries like stricten their all immigration laws, so stricten their all like immigration laws and all these rules. So it's a lot of things which we can prevent our infection. Once again, like the ultimate prevention is always, once you know about HIV, then there is no HIV. Thank you.
Yeah, so we came to know this much things regarding HIV. So like we can manage also, right? There must be some management for the HIV. Yeah. Now we have all seen the diseases, how it is spread, and the transmission process, the pathophysiology, the diagnosis. Now when we come to the management, the main focus of the management, we are focusing on the person who is infected. The person, once he is infected, you have to check him whether he is infected. That is done with HIV 1 and 2 rapid tests. And afterwards you go for enzyme test, that is Western blot test. It is a modern methodology where it can confirm the person is infected with HIV. Make sure that before you tell the person is infected with HIV, you confirm yourself, you cross-check double the time and then tell him. Not before, you are not supposed to reveal it before. And once you come to the management, the main focus is the HIV infected person's immune system will be very low. CD4 T cell count we have to monitor. And once you know that the CD4 T cell count is less than 200 ml, 200 millicubic meter, 200, then you come with the management of ART therapy. ART is nothing but antiretroviral therapy. That is said ART. And when you deal with the pediatrics, you call it as HAART. HAART. It is highly active antiretroviral therapy. So you have two managements, one for the adults and one for the pediatrics. And then every management you need to have, as a physician or as a nurse, you need to have certain goals and principles. When you come to the goals, the first goal is you should know the viral load. The viral load is always less, and the immunity will, because of this, the immunity will be very low. And when you come, and always you should make sure to maintain or increase the CD4 T cells. Once your treatment is effective, it should be shown in your blood results, and blood count should tell CD4 T cells should be increased. Otherwise, your treatment, something and somewhere is going on wrong. And then the principle of treatment is very important. As a nurse, once you identify a client to have HIV/AIDS, you have to counsel him. You have to tell him what is the disease and start with the treatment with ART therapy. And once you start, the family has got all the rights to know what the patient is suffering from, especially the spouse. If you don't mention to the kids, it is not important. But mentioning to the spouse is considered to be very important because the transmission rate can be prevented by this. And then the moments are the people who are mainly victim, and because of this, there is something called as ventral transmission. When the woman is pregnant and she transmits it to the fetus, it is called ventral transmission. And in this principle, regardless of the gestational weight, you start with the ART therapy. And then now the drug classification. The drugs are classified on main 5 headings. There are 5 drugs which we give for the HIV infected person. The first drug is non-nucleoside reverse transcriptase inhibitors. It combines with the transcriptase enzyme and it blocks the HIV RNA to convert into HIV DNA. As we all know, HIV, it's RNA, and then slowly it converts into DNA. That is the first treatment methodology. Then the next one is nucleoside reverse transcriptase inhibitors. In this process, if the person is already in a stage where the RNA is converted into DNA, now you have to tackle the DNA because already the process is converted, and further you give a tablet where there is artificial DNA, a normal DNA, and this DNA and the HIV DNA is replicated. And because of this, HIV DNA is not formed. And if once the DNA is formed, we all know it can multiple number of DNAs are formed. So because of this nucleoside reverse transcriptase inhibitors, the DNA formation is again stopped. The next one is Nucleotide. Remember, the third drug is nucleotide reverse transcriptase inhibitor. It inhibits the action of reverse transcriptase formation. The fourth drug is protease inhibitor. Protease is the enzyme which is essential for the DNA, HIV DNA to cut short and to form again a new strand. And when you give this protease inhibitors, this protein is not formed, and again you are stopping the replication of HIV DNA. The last one is entry inhibitors. Once the HIV RNA is converted into HIV DNA and the protein, the medication protein inhibitors is also not effective. We go with the last treatment modality, that is entry inhibitors. In this entry inhibitors, you give this particular drug so that the HIV will not go and sit on the particular cell, and this is stopped. Hence any HIV DNA cell will not sit on the cell, and you can prevent the multiplication of HIV. And we have already seen there are many adverse reactions to the art therapy. When you give art therapy, you primarily counsel the patient what are the adverse effects he is going to face. Mainly once you start, it is just like your chemotherapy drugs, how the patient suffers, same art patient also suffers. You see the signs and symptoms of nausea, vomiting, headache, unusual dreams, and there is extreme weight loss. Depression and hyperlipidemia is seen in these people. And we have, as my friend had said, HIV once it starts, there is a sweet time period of 12 years, and that is called window period. One, otherwise called the incubation period. Once the person is affected, to get AIDS, it takes a beautiful time of 12 years. Until then, the person can spread to many people, and to this we have to treat, and at this time it comes with few minor symptoms, whereas at the stage once he's crossed 8 years, 10, 12 years, you can see opportunistic infections. Opportunistic infections like he can have respiratory problems, GI problems, and many other infections, and ultimately it leads you to multiple system organ dysfunction. And in this, there are some opportunistic treatments. Opportunistic infections can be easily treated, and we have, because of the advanced science, we can cure all the opportunistic infections, and the person ultimately dies because of AIDS and this opportunistic infections. AIDS is acquired immunodeficiency syndrome. And then the vaccine, as my friend said, there is monoclonal antibodies. Yes, the scientists are certainly doing a vast research on HIV AIDS to get a vaccine, but the scientists are unable to tackle this because the mutation of HIV virus takes place every now and then. If you are forming a vaccine today, after 10 days, the HIV protein DNA chain is changing, it is modifying and mutating. Because of this, we are not able to tackle this problem, and we are not able to get a new vaccine. And there are two types of HIV. One is HIV-1 and HIV-2. Again, when you come with the HIV-1, there are 9 subtypes, and because of this, each subtype has got its own DNA adenosine. You know, right? The DNA adenosine, tyrosine, uracil, cytosine formation. All this will change in all the 9 subtypes, and 9 new strands are there. Because of this, we don't have any vaccine, but at present, and to the market, they are not launched. But there is a vast research going on for this vaccine, and many countries, the WHO is working hard to get a vaccine. So this is how the management and the advanced research what is going on for AIDS and HIV. Thank you.
So we are back to the second session. We had our first session on problem-based learning, and our topic was HIV/AIDS. We were given a scenario where we had to go through a lot of our textbooks and we had to find answers for our questions. And today I hope that we all are filled with a lot of knowledge. And so this is our small recap session where we will contribute few points and our opinions on this what we have learned. So it will be beneficial to us. Let us recap. Anyone can start with the definition of HIV/AIDS or the treatment part.
I think we have gained a lot of knowledge in our session. So to know more about the HIV/AIDS, HIV infection or AIDS, to know more about that, we have to start with the definition. To start with the definition, HIV infection or will get influenza, means influenza like symptoms person will get, and it will means prolonged period no symptoms will be there, then he will develop some symptoms as we all have seen it that way. And about to know about the more, so to know about more in that first in that means the person who is having HIV is more prone to get the pulmonary disease because the immune system will get reduced. So the pulmonary disease, the infections or the pulmonary infections, the disease will be more.
And to talk about the incidence, the worldwide estimations of the HIV or AIDS is 34 millions. And among 34 millions, 17.2 millions are the men and 16.8 millions are women, and 3.4 are the people who are less than 15 years of age. Yeah, and Sub-Saharan Africa is the largest country who is having HIV/AIDS. Highest number of the HIV people are having in Sub-Saharan Africa. And in India, and according to the family welfare reports from 2010 to 2011, they have estimated about. They said that India has the largest numbers of the HIV people living in India. Third largest. India is third largest. Yeah, it's the third largest country, and they have estimated around 23.9 lakh of people having HIV/AIDS. This is the incidence estimated by the family welfare reports from 2010 to 2011.
So if this might be the cause, prevailing all over the world,
And we are in the third portion.
what are the reasons why our India is?
Can anyone say what are the causes of this mass incidents in India?
We have been already concluded when we found that our country, India, is estimated as third largest country which is having this much infected with HIV burden. So we should know that what is the main causative and how this is being caused, and we should know the mode of transmission. Yeah. So while coming to the causes, the most important thing is the causative agent. We all know that HIV itself is the causative agent for the AIDS. So this is a disease which is not like transmitted like airborne disease or water disease. This disease does not get transmitted while we do handshake or through kissing and all. This is a disease which this virus is being transmitted through blood, body fluid, not all body fluids like menstrual fluids and vaginal discharge. Through this disease virus is transmitted, and unlike in hospitals, in hospital also due to the health staff negligence through needle pricking with HIV/AIDS infected patients, and again through one most important thing is through blood transfusion. Most of the cases has been detected from the blood transfusion. Yeah. Again one thing is vertical transmission. That one is from mother to child. And there is also incidents like this HIV infected through sexual and this why this disease is prevailing is mainly due to the social stigma, right? Our this population of our here are not that much literate, so they think something backward while coming to discuss regarding this disease. So it is poverty, poverty and
Poverty and all related persons who are at risk for this.
I think sex workers and health workers who have needle injuries and travelers, those who travel long distance, and mostly I think people those who have multiple and this annosex and non-sex are also one of the high risk for getting HIV/AIDS.
What might be the clinical manifestations of this? What the person would say.
How are the signs and symptoms? Talking about the clinical manifestation, it will vary. It depends upon the phases of infections. In case of primary infections, because of the reduced immune power, there may be fever, headache, then joint pain, diarrhea, then ulcers in the genital tract and mouth. And in case of when talking about secondary infection, there may be weight loss. It is the main clinical management and see patient we can see by looking also we can see the weight loss. Then blood vision will be there. Then cough and shortness of breath will be there.
because the low immune power.
Low immune power.
But this will be gradually decreasing within this few months or weeks.
Within a short period, the person will decrease more weight.
Not like a normal person losing when it is
within few
gradually
days.
decreasing.
But how this it means replicating in the body means what will be the
We have known like this virus, HIV is causing AIDS and it is prevailing in almost all the countries. And in this much developed or high-fi this medical world today, we are not still able to clearly bring out the clear solution to this problem. The very reason is this virus is a retrovirus which has a protein-like cell covering the virus which can directly go and attach to the receptor of CD4 cells. This means when this virus gets into the body, they will fuse, then they will transfer this DNA and enzyme into the human cell. By this time they can't produce anything. They need an enzyme to replicate themselves to double-stranded DNA. So, through this enzyme they will replicate in the body. By then only the process of division start and this will form in the whole cell and form into the small these virions. Then these long virions they will be divided by the help of this proteinase enzyme into the small these virions and they will be replicating in and the whole cell will die by this time and these small virions they will be sent off into the other CD4 cells and the same process again will reoccur. By this time the immune system will be decreasing very much gradually. There may be signs and symptoms may or may not be present but the immune system of that person will be decreasing.
Later only we will came to know about it.
Yeah, so the period of the gap from the person being exposed to the symptoms vary from like 2 to 10 years.
Because these CD4 T cells are the main conductor of this our immune system. They will be mediating all the immune system defenses. They will be directing all the process, how to act, how to do this immune mechanism and all. If once these cells are infected, then obviously the person's immune system will be decreased. So all the opportunistic disease, whichever is there, which a normal person can easily handle, will become problematic to HIV infection. So obviously it became very serious.
So till the signs and symptoms we will not be able to know about that the person is having HIV. So what may be the, because after going to hospital only the person will came to know that he is having HIV. So what may be the
Then comes the diagnosis part. Guys, you know, that is a very important part in having HIV because you know why? It should be handled carefully. As the result indicates HIV positive and negative, it have a reciprocal relationship between the patient's life. If the patient is HIV positive, automatically you will be in negative phase in his life because depression. And if HIV negative, will be very happy and is a free from
for treatment HIV means it is that can't be curable.
That's why as a nurse we have to handle that situation very carefully. Yeah, HIV is most commonly it's diagnosed by blood test and saliva test, and we will look for the antibody. So, but
I think so from saliva it will not transfer.
we can diagnose from saliva. I think unfortunately, if it's in early stage, immediately after the infection, we could not know that blood test. 12 weeks. But in some rare cases, it may go up to 6 months.
6 months, yeah. So we have to timely do the test again when the patient is suspected.
Yeah, but it was an older method. Now recently, because of some research, so new methods are came. So in that check for their, before we check for antibody, so now they are checking for the HIV antigen. A protein is immediately after a protein is produced in the body after the infection. So we can also, in early stage only, we can find the HIV. So this is early diagnosis from precaution. Precaution. We can do so many precautions, and after once we know the patient is HIV infected, so we have to do so many other tests to.
Okay, but absolutely right, Naveen. Actually, we know that C4 T cells, which is a white, C4 T cells, which is a white blood cell, and which is the more affected one by the HIV.
and this it will be means attacking this CD4 cells, and it will be destroying.
Normally it is 500 to
500,000. It will be reduced to less than 200. But when it will be less than 200, we can confirm it that the patient is affected with HIV, and it will be leading to AIDS. And actually, then one more test is there, that a viral test we can do, because in that blood, the viral load will be more in the blood. Okay, if that patient is having viral load is more, means we can confirm that patient is having affected with HIV. Then patient will show drug resistance. Patient will be showing this resistance to the this HIV drugs. HIV, they will be showing the resistance will be shown by the patient. Then we can go for this complication. We test for the complications like hepatitis, tuberculosis. Yeah, for that we can go for. And
like this much knowledge we are able to share among each other. So our problem-based learning, it's like it is so much effective, right? I hope like HIV, regarding HIV, everything is clear by now. So
We all have sufficient knowledge regarding
regarding HIV,
the clinical manifestation, and HIV-related tuberculosis, which many people suffer from. Thank you so much.
Thank you.
Thank you.